Welcome back to the Now Morning Show. It's just about 17 minutes after the hour of 6 o'clock. And we have Edie Stewart, the president of the TNT Registered Nurses Association, on Zoom with us to just talk about how the nurses have been surviving, this third wave of the positive cases of COVID-19 here in Trinidad and Tobago. Good morning to you, Edie.
Yes, and good morning to you and your listeners.
And how are you doing?
I can't complain at this moment. I know a number of our members are doing much more difficult than me, so I can't complain.
Right. So talk to us about, just mentally how the nurses are doing. How are they coping? Because the thing is that we have a lot of junior nurses, new people who've been brought into the system, who's just been, thrown into the system and has to kind of been learning on the job, but also treating with COVID positive cases. How are they coping, as well as the more seasoned ones?
Where could I start? I definitely would not be able to do justice to exactly what they are facing currently. And with the announcement last evening that we had 601 new cases, and if we use the measurements by Dr. Richards, that at least 12% of those would require hospitalization care. And we're already bursting at the seams. It's really a worrying concern for us going forward. For the nurses, if I could just jump off from what a recent publication in the Lancet Journal would have indicated, published only in March the 1st, 2020. Healthcare workers, not only nursing personnel alone, but definitely nursing personnel and medical doctors also, they have to care for some of their own colleagues during this period. That is something rarely used to happen at this large scale, where we have a number of our own colleagues that we have to see about. Also, we have to see about comforting dying patients, some of them dying, unfortunately, who are isolated from their loved ones. It generally part of that process would see family members coming in, getting that opportunity to counsel their own relatives, internalize that they may be losing their loved ones. And that is not happening at this point. COVID death is a very lonely death currently. So it is really heart-wrenching for the family, we could understand, but it's also heart-wrenching for the nursing staff, because the only person that patient is seeing constantly would be the nursing staff and the medical doctor. So it's a very lonely, and you have to take up that burden. You have to take on that on your shoulders to really comfort those patients. And we would have seen there's a recent clip going on showing how a patient has lived their experience during COVID, and he was talking about, it's being played on one of the television stations. He was remarking how the support he got from the doctors and nurses, and because he spent himself in Cora Hospital over 11-day period, and only person he was seeing was the nursing staff, and he saw and he remarked how they comfort the patient, how there's something simple as holding their hands, because they know there's no relative to come in to do that job for them. So it's really something we really want to think. And then also the real difficult task of informing and consulting and consoling the relatives of these patients. Generally in Trinidad and Tobago, the doctors really do that. We are not really as forceful as yet, unfortunately, but the nurses tend to take up that responsibility. So the doctors, and there was a clip where one of the relatives would have taped the conversation with the doctor, maybe inappropriately, but it definitely pointed a spotlight on how that discussion goes. And especially when it's a discussion where end of life issues you are discussing, really letting a staff, a relative know that, we are doing all that we can, but we are not going to go above and beyond because if we inflict, if we provide any additional care in terms of resuscitation, in terms of life support, it may do more damage than good. That is a difficult conversation. I remember when I went to UWI, there was actually a communication course where you had to break bad news. Most nurses and doctors would remember that course. And where you pull aside the relative, you put them in a separate quiet zone, and you go through the process, because you know it is not an easy task. They not even get any opportunity to provide that level of counseling. It has to be done informally over the phone. The person is not even seeing your facial expressions, your empathy. They cannot see that. So that makes it even more difficult for the patient.
Edie, talk to us. At the association level, do nurses reach out to say, you know, they're stressed or they're burdened because they have to be going through these things? And what do those numbers look like compared to the amount of nurses that we have?
Oh, definitely. I was walking around, myself and my second vice, Ms. Cox, in Quora yesterday, and I would have received, I'm not over exaggerating, in excess of 50 text messages, calls, telling me how difficult their troubles they are going through at this point in time.
Share with us some of those messages, yes. Because I think, you know, what I'm really trying to get is for the population to understand yes. how these frontline workers feel, because we keep talking, you know, they are so burdened and we sound so stiff, and we're not getting it that these people are under as much stress as probably even the patient with COVID.
Definitely, definitely. So besides the medical conditions, which some of them are developing, gastric ulcers because they are not eating on time, musculoskeletal problems, and their neck, their shoulder, back pain, being on your feet, these long hours, developing urinary tract infections, UTIs, varicose veins, metabolic syndromes, diabetes, some of them even putting on weight during this time, because the only time you really get to eat a proper meal is in the night. So some of those things is one of the main areas I am seeing is the mental health issues. And that is really an eye-opener. It is expected. The literature is replete with examples when nurses work these extended long hours, mental health issues begin to creep in. So we're getting nurses complaining of anxiety, depression, insomnia is standard now. There's no nurse I am speaking with that is not experiencing insomnia at this point. Most of them are using sleeping aids to assist them with sleeping. So tablets, a number of them have resorted. Nurses who have never complained with insomnia before are now experiencing insomnia. Moral distress, understanding that we have limited ICU beds, limited HDU beds, limited ventilators. So now it's a decision who gets these ventilators, who gets these HDU beds. And that is not an easy scenario to deal with, especially when the nurse is dealing with younger persons. And that is a large portion what nurses are seeing now. A number of the patients are 40 years. So some of them are treating persons who look like them. They are same age. Before, in the first and second wave, generally it would have been 70, 80-year-old persons. So that's one thing to internalize. But when you are treating your own colleagues, your persons looking like you, same age, and you to yourself know from past experiences due to the state of
have we had any nurses who's quit the job because of the pressures of the pandemic?
Oh yes, we already have that. We already have nurses migrating. We already have nurses leaving, because you have to understand, nursing to come into nursing is almost the same qualification as medicine. Almost, that is, and even majority of the nurses have those qualifications. Some of them just choose to come into nursing. Some of them didn't get into medicine, so they choose nursing, and then they would have worked their way up, well, across, I shouldn't say up, to get into medicine. So some of them are choosing, look, what is the point of going through all of this? for sadly the compensation that you would get. So some of them have chosen to leave and to take early retirement. Some of them, but it's very few. I must say 90%, 95% of nurses are really saying, look, this is what I've been called for, and they are sticking to the task. The only ones who really have dropped out were the ones who really would cut out for nursing. So that's very a small percentage. And they're really seeing what nursing is. It's not glamour, it's not glitter. There's no accolades you will be getting for doing this job. It's a labor love. So if your heart.
Do we have nurses who are refusing to work, with COVID patients just because of the risks, the exposure?
No, I haven't come across that in any large measure. It's just one-off. You will have sporadic cases, but any large measure, what nurses would be telling us is that they just want to make sure the necessary PPEs are in order, that their families would not be exposed. So they have been asking for certain minor things, in my opinion, and I believe the government could have provided those basic amenities, but such as life. But what we really also are seeing is a type of burnout syndrome within some of our nurses, where they are basically experiencing, besides the lack of energy and exhaustion, besides they're also feeling that increased mental distance from their job. And you really would have to appreciate how one become distant from their job in terms of this environment, because to care is very a difficult task when you know you're going to lose that person very often. And there's a repeat, they are constantly telling us about the high turnover rate of patients. So you tend not to get that close. It's difficult, but it's a coping mechanism.
What measures are in place for these nurses when they're going through this stress of, whether it's a high turnover rate, whether it's a fatigue, whether it's the anxiety? What's in place to help them to get through these issues?
There is a hotline provided by the North Central Regional Health Authority, which you can call. I hope nurses are utilizing it. It's being run by Professor Hutchinson and a team of nursing staff. I actually saw them walking around yesterday in Cora, checking up on some of the nurses. I'm not sure if they're going to cover, but the hotline is present for them. So that is.
Do you think it's sufficient? Do they believe it's sufficient? Is it good enough?
I believe more could be done. Obviously, we are the association. We would always like more to be done. And the nursing staff have indicated to us that they would like much more tangible issues. Yes, the phone call may help a bit, but there are other things that the nurses would like to see going forward. So that's really it in a nutshell. But I really want to point out, I was trying to get an appreciation of what the nurses go through, because everyone has seen the hazmat suits. I'm not sure everyone understands how uncomfortable those suits are to be kept on for 6 hours, 7 hours sometimes, 8 hours sometimes, and how humid those hazmat suits could be. And I saw a nurse in Cora, one of the units yesterday, and I was speaking to her through a door. There was a glass partition in it, and I actually saw the beads of perspiration coming down her face, and I know it's going into her suit and down into her gloves. And trying to picture that nurse in that for 6 hours really is something that I don't think the average person understands.
Actually, we were talking about that on the show here. I think it was just earlier this week on Monday, that, these nurses have to be stuck in these suits. They can't go to the bathroom, they can't eat, they can't take a break. And sometimes if you don't get that relief, it means that the hours are even longer. How are those nurses coping? The ones who have to be under this extreme stress of being in those hazmat suits for so long?
Exactly. Well, you highlighted it quite clearly there, where if you don't, because that's the nature of nursing, if you don't get relief, for whatever reason, you have to remain on duty. And that's just the nature of nursing. Fortunately, some of the nurse managers are doing their best to try to move around staff. So even though you don't get relief, they will find somebody else to replace you. It's not ideal because if you are not stationed on that ward and you are familiar with the 20-something patients you have to take care of, then that means a new person coming into that environment who has not been working on that particular unit does not know all the medication those patients have. They don't know the patients by name. So now they have to relearn all of these patients, and that in itself is a task, and that could be very traumatizing for a junior nurse, because the majority of these nurses who are in Couva, 95% are very junior nurses. I'm speaking about 1 year, some less, some a little more, but no more than 2 years. So these are junior nurses who were at home awaiting employment, eager to get in the job market after going through 4 years of nursing school, and now you drop them in to one of the worst pandemics the world has ever seen for a long time.
And hopefully all of them will be able to get through that. But Edie Stewart, we do have to leave it there. Thank you so much for sharing with us this morning. And we do hope that the nurses who are relying on so heavily will be able to survive this pandemic as much as we do.
Thanks for having me.